Carpal tunnel syndrome is a common condition that affects the hand and wrist. It happens when a nerve in your wrist, called the median nerve, gets squeezed or compressed. This nerve is very important because it gives feeling to your thumb, index, middle, and part of your ring finger. It also controls some of the muscles in your thumb. Imagine a tunnel in your wrist. This tunnel, called the carpal tunnel, is made of bones and ligaments. The median nerve and tendons that help your fingers move pass through this tunnel. When the tissues around the tendons in the carpal tunnel swell, it puts pressure on the median nerve. This pressure is what causes the numbness, tingling, and pain that are the hallmarks of carpal tunnel syndrome. Carpal tunnel syndrome is often caused by repetitive hand movements like typing or using tools. It can also be caused by other conditions, such as pregnancy, arthritis, and diabetes. It's important to understand carpal tunnel syndrome because it can make it difficult to do everyday tasks. Early diagnosis and treatment can help prevent the condition from worsening. To understand carpal tunnel syndrome, it helps to picture the anatomy of your wrist. The carpal tunnel is a narrow passageway on the palm side of your wrist. It's formed by the small bones in your wrist called carpal bones and a strong band of tissue called the transverse carpal ligament. The median nerve, a vital messenger between your hand and brain, travels through this tunnel. This nerve carries signals that control sensation in your thumb, index finger, middle finger, and half of your ring finger. It also controls the muscles that allow your thumb to move and pinch. Alongside the median nerve, tendons also pass through the carpal tunnel. These tough, fibrous cords connect muscles to bones, enabling your fingers to bend and straighten. When these tendons become irritated or inflamed, often from overuse or repetitive motions, they can swell and press on the median nerve within the confined space of the carpal tunnel, leading to the development of carpal tunnel syndrome. Carpal tunnel syndrome develops when the median nerve in your wrist is compressed. While the exact cause isn't always clear, several factors can contribute to this compression. Repetitive hand movements, often seen in jobs involving typing, assembly line work, or playing musical instruments, are a major culprit. These repeated motions can irritate and inflame the tendons in the carpal tunnel, putting pressure on the median nerve. Certain medical conditions also increase your risk. Diabetes, rheumatoid arthritis, and thyroid disorders can cause inflammation and fluid retention, which can affect the carpal tunnel. Pregnancy is another common culprit, as hormonal changes can lead to fluid retention and swelling in the wrists. Additionally, obesity, wrist injuries, and even genetics can play a role. Understanding these risk factors is crucial for prevention and early intervention. While anyone can develop carpal tunnel syndrome, certain factors increase your likelihood of experiencing this condition. Occupations that involve repetitive hand movements, such as typing, assembly line work, or using vibrating tools, significantly elevate the risk. People in these professions often experience strain and inflammation in their wrists, which can compress the median nerve. Certain medical conditions also make you more susceptible. Diabetes, rheumatoid arthritis, and thyroid disorders can cause inflammation and fluid retention, potentially affecting the carpal tunnel. Pregnancy is another common risk factor, as hormonal changes during gestation can lead to swelling in the hands and wrists. Obesity, wrist injuries, and a family history of carpal tunnel syndrome can also increase your risk. Being mindful of these risk factors is essential for early detection and taking preventive measures. Section 5. Recognizing the symptoms, early signs, and later stages. Carpal tunnel syndrome typically starts gradually, with subtle symptoms that may come and go. One of the earliest signs is numbness or tingling in your thumb, index, middle, and part of your ring finger. You might notice this sensation at night or when you first wake up. As the condition progresses, you may experience pain that radiates from your wrist up your arm. This pain might be worse at night or after activities that involve repetitive hand movements. In later stages, weakness in your hand can develop. You might find it difficult to grip objects, button your clothes, or perform other tasks that require fine motor skills. Early recognition of these symptoms is crucial for seeking timely medical attention and preventing potential complications. Section 6. When to see a doctor. Diagnosing carpal tunnel syndrome. If you experience persistent numbness, tingling, or pain in your hand and fingers, it's essential to consult a doctor. These symptoms could indicate carpal tunnel syndrome, and early diagnosis is crucial for effective treatment. Your doctor will ask about your medical history, including any repetitive hand movements or underlying conditions. They'll examine your hand and wrist, checking for tenderness, swelling, and muscle weakness. To confirm the diagnosis, your doctor might recommend a nerve conduction study. This test measures the speed at which electrical impulses travel through your median nerve. By assessing the nerve's function, doctors can determine if it's being compressed in the carpal tunnel. Additionally, your doctor might order an electromyography, or EMG, to evaluate the electrical activity of your muscles. This test can help rule out other conditions that might be causing your symptoms. Section 7. Conservative treatment options: rest and splinting. In the early stages of carpal tunnel syndrome, conservative treatments are often the first line of defense. Resting your hand and wrist is crucial, especially if repetitive motions are contributing to your symptoms. Avoiding activities that exacerbate your pain can help reduce inflammation and allow the median nerve to heal. Your doctor might recommend wearing a splint to keep your wrist straight, particularly at night. Splinting helps reduce pressure on the median nerve by preventing your wrist from bending. Maintaining a neutral wrist position during activities like typing or using a computer mouse can also alleviate symptoms. By reducing strain on the median nerve, these conservative measures can provide relief and prevent further damage. Section 8. Medications and injections. Managing pain and inflammation. If conservative treatments aren't providing sufficient relief, your doctor might recommend medications to manage the pain and inflammation associated with carpal tunnel syndrome. Non-steroidal anti-inflammatory drugs like ibuprofen or naproxen can help reduce swelling and alleviate discomfort. In some cases, your doctor might prescribe corticosteroids, powerful anti-inflammatory medications, to be taken orally or injected directly into the carpal tunnel. Corticosteroid injections can provide short-term pain relief and reduce inflammation, but their effects tend to wear off over time. It's important to note that corticosteroid injections aren't a long-term solution and are typically used in conjunction with other treatments. Your doctor will determine the appropriate medication and dosage based on the severity of your symptoms and your overall health. Section 9. Surgical intervention. When other treatments aren't enough. When conservative treatments and medications fail to provide lasting relief from carpal tunnel syndrome, surgery might be necessary. Carpal tunnel release surgery aims to relieve pressure on the median nerve by cutting the transverse carpal ligament, the band of tissue pressing on the nerve. This procedure can be performed endoscopically, using a small camera and instruments inserted through tiny incisions, or through a larger, open incision in your palm. Endoscopic surgery typically involves faster recovery times and less scarring. However, your surgeon will determine the most appropriate surgical approach based on your individual circumstances, such as the severity of your condition and the presence of any other medical factors. Section 10. Life after treatment, recovery and prevention. Recovery from carpal tunnel syndrome treatment, whether conservative or surgical, takes time and patience. Following your doctor's instructions and adhering to the recommended rehabilitation plan is crucial for optimal healing. After surgery, you'll likely need to wear a splint for a few weeks to protect your wrist as it heals. Your doctor or a physical therapist will guide you through exercises to restore strength, flexibility, and range of motion in your hand and wrist. Making lifestyle changes can help prevent carpal tunnel syndrome from recurring. Ergonomic modifications to your workspace, such as using a vertical mouse or keyboard wrist rest, can reduce strain on your wrists. Taking frequent breaks during repetitive activities to stretch and rest your hands can also be beneficial. Section 11. The importance of early detection and care. Carpal tunnel syndrome is a common condition that can significantly impact your quality of life. Early detection and treatment are paramount for preventing the condition from worsening and minimizing potential complications. By recognizing the early symptoms such as numbness, tingling, or pain in your hand and fingers, and seeking prompt medical attention, you can increase the likelihood of successful treatment and a faster recovery. Understanding the causes, risk factors, and treatment options empowers you to take proactive steps to protect your hand health and maintain your ability to perform everyday tasks with ease. Remember, early intervention is key to preventing long-term discomfort and preserving your hand function.
Thanks for watching. Please like, share, and subscribe. And remember to click the notification bell to know when future videos are released.